Hey guys, welcome back to Alpha Physio Pelvic Care. Today we are continuing our series of tips, exercises, stretches and so on for pregnancy. I already made a video about pelvic floor release. You can check it out. However, if you noticed, quite few pelvic floor releases and techniques are done in laying down. This can become a bit of a problem, especially in the second and third trimester. Many women will find it very uncomfortable to lay down flat on their backs because of the fetus pressing the main vein, vena cava, and women will become dizzy. Well, this problem can be sorted by semi-reclining. However, again, many positions are done with the legs higher than the heart level, and the bottom is kind of higher a little bit than the shoulders, and again, not very comfortable. So today I will show you some positions and techniques where you can get pelvic floor release if you are pregnant, and that are safe in pregnancy and will not compromise, the position will not compromise your comfort and your safety. And of course, if you're not pregnant, you can also do these stretches if you find that laying down on the back is not your favorite position. So don't forget to press the like button. Make sure you share it with your pregnant friend so that they know. And also please subscribe if you enjoy my videos and you haven't subscribed yet. So let's begin. I'm sitting here, so I will also start in a sitting position. What we're aiming for is we're aiming to open up the pelvic outlet, so the outer part of the pelvis, the outer part of the pelvic floor, and to relax it. The suggestion of doing pelvic floor exercises during the pregnancy is not wrong at all. We do want to have functional, strong pelvic floor even during the pregnancy, and it's safe to do pelvic floor exercise in pregnancy. Some people will avoid it. Some healthcare professionals will not suggest to do it in the first trimester just in case. There is no scientific proof behind that. If you feel like, okay, I want to wait it out for the first trimester, it's absolutely okay to do so. However, in the second and third trimester, you're absolutely safe unless there is very, very specific medical reason that your doctor can tell you about. So we do our pelvic floor exercises, but we also need to learn to release your pelvis floor. Because if you are planning and aiming for vaginal birth, we want that pelvic floor be relaxed enough to let the baby out. We don't want to be tight and with the lesser mobility and elasticity, because this can potentially lead to more trauma of the pelvic floor, maybe tears, or maybe not so positive experience. But I really hope you all have great positive experience in your birth, whatever it is. So I'm sitting here, and I'm creating here triangle with my legs. So my bottom leg is down, my top leg is up. Okay, my lovely belly is here, that I created in order to feel it better, and you give the visual impression. And here what we can do is we basically roll on and off our hip. Okay, what we start to do is we start to rock that pelvis, opening up our pelvic floor, taking nice deep breaths, keeping our weight about 50-50 between the arm and the leg. I really hope you don't have any problems with your shoulders. If you do, you can do some other stretches that I will show you. So breathing in and breathing out, rocking backwards and forwards just to open up the area. And of course, we're getting onto the other side, opening up here, and again, rocking forwards and back. Especially if you have a sitting job, if you're sitting all day long and you feel this area is really immobile, is getting numb, is getting tight, it just needs some movement, it just needs some blood flow. You just rock forward and back. Okay, great for hip mobility, great for low back, great for your pelvis. Then I will give you a variation of the stretch that I do with everyone, but because, as I said earlier, I don't want pregnant people to lay down flat, we will use our arms here. I will use my arms. However, If you can't use your arms or you prefer to lay down, you can lay down at around the angle of 45 degrees, creating this angle with several pillows. You can do so. I will use my arms for this purpose. Also my my pregnancy Pilates class participants, they are usually dropping on their arms and there is no problem. If so, several pillows to keep you at around 45 degrees angle. So I'm dropping here my arms, so I'm not completely flat, bringing my feet together, and I'm just taking nice deep breaths as much as I can into my side, and I'm just making small movements with my knees. Butterfly, and breathing in and breathing out. You can stay there for a minute and a half, and out. And of course, you can do the same movement, excuse me, in the sitting position. So nice and open. This will more open up your inner thigh muscles and the front part of the pelvic floor. It might not open that much the back part of the pelvic floor, which we'll have a look in a bit for the stretches. Okay, nice and open, like butterfly. Go easy on this stretch if you do have pubic symphysis pain. If it makes it worse, then skip this one. And we can just roll side to side. And everything is accompanied with nice, deep breaths. Nice. Okay. Then we can also go onto our side. So usually what I would do, people who are not pregnant, it's lay down and rotate their hips. Not the most comfortable position when you have a belly. So what you do is you go onto your side, you can support your head with the head or just put a pillow. You grab your knee from here, okay? And you just take nice deep breaths into your side. Here I'm doing a bit of pulling, a bit of rotation. Can rotate. Okay, keep your hip open. Deep breath and relax. Here already you're starting to get that stretch also at the more back part of your pelvis. You can also give it a bit of a stretch here to stretch your front thigh. Again, great position, very steady. If you can't stand and stretch your front thigh, you can do it here and then you can alternate. Breathing, we don't do any kegels or anything here, no contraction, no pelvic floor engagement, we just stretch. And of course you do same thing on the other side. So supporting yourself, you can rotate here a little bit if you wish. Depends on your comfort and the size of your belly. You can always place a pillow under your belly if you need to. Okay, and here there is not much control of position. You just let go, you just rotate. Excellent. And keep breathing. Nice. Then you can return back into on the arm position. If you noticed, I'm alternating so not to tire your shoulders. If there's different positions, I like to alternate them between so your knees don't get too tired, your shoulders, your elbows don't get too tired. So this is a variation of the classic performance stretch, but because we don't want to strain our abs, neither we want to be flat, what we do is we place our one leg on the other knee, and usually with 95% of my pregnancy, this is fine, and we just rotate here. Breathe in and breathe out, and there is plenty space for belly. Breathing in, out, breathing in, out, and we do about 1 minute each side. Okay. And the opposite, again, if you wish, you can be semi-reclined, so you don't have to use your arms, and this is fine as well. And rotate. Keep breathing. Think about the area of your vulva. Think about it, relaxing, releasing the tension, keep breathing. We will really need it for labor, but generally we want our pelvic floor to be also relaxed, naturally relaxed. Okay, great. And then we can pop ourselves onto 4-point kneeling. 4-point kneeling is my favorite. So here we always create a little bit more space for our belly. I'm going here on the hands fully. You can also drop here. It depends. I do have ladies who really struggle with this position because all the reflux will come up. So either here or here, up to your preference. And we start here, just rotate. And as we go back, we really think about opening, almost visualize opening these two tailbone, these two sitting bones here. We open, go forward, breathe in, breathe out. Here we don't need to contract anything. We just stretch. We just move those hips. You can stay a little bit in the position if you want to. So this is your reverse position. You can go into it to release the pain from, if you suffer, for example, from varicose veins around your genitalia, or if you have a back pain, or if you have a sacrum pain, it's a great position to be in, as soon as it's not provocative for any other symptoms you might have. And you can stay here for 30 seconds, come up, rotate a little bit more. Rotating, don't forget the opposite direction if you go one direction. Don't ignore the opposite. And down again. Here also you can rotate your hips a little bit more in, a little bit more out. So first you do one variation. My tiptoes are now in. So my hips are rotating in. And now I'm rotating out. So I'll give it a variation, a stretch. Lovely. Okay, and then we can go on our wonderful 4-point kneeling. I like to keep the knee open. Again, see that this position doesn't provoke any symptoms of your pubic symphysis. And I like here to go forward, turn away, come back, turn in, breathe in and out, breathe in and out, breathe in and out. And of course, do not forget the other side. So I'm rotating away from my hip, breathing in, breathing out, return. I'm doing the breath just for the sake of breathing, just to have that rhythm. If you do the opposite breathing, it's not super important in this particular stretch, as soon as you breathe. Okay, a lot of us, you can see hip movement, pelvic movement, stretching out, opening the area. Nice. All right, guys. So these were your releases of the pelvic floor and the hips, we can say, if you are expecting. So these exercises, these releases are safe if you're pregnant. Let me know, guys, if you try them. You can do all of them. You can just pick and choose which one you feel more comfortable, you like them more. You can do them anytime you feel like doing them in the evening, that's fine, or maybe morning, or maybe if you can at work. They're perfectly safe to do anytime you feel like you need to refocus on your body. Thank you for your likes. Thank you for your shares. Thank you for your subscription. Thank you for watching this video. We will see you guys very, very soon. Bye.